Okay, so a lot of response for D. Which gland releases glucocorticoids, such as cortisol, in response to increased adrenocorticotropic hormone, or ACTH, from the anterior pituitary? And so the answer here is adrenal cortex, right? Not adrenal medulla. Remember, the medulla is going to be the chromaffin part that is involved in the autonomic nervous system. The cortex, or the outer region of the medulla, is what is responsive to ACTH, okay? All right, so the answer here was D. And as just a quick, helpful test-taking tip, it's really nice to read a question. So when you read your questions, you should cover the answers, especially as you practice. You may get better at doing this on an exam or so, but as you practice questions, try to read the question, just the stem of the question, read the lead of the question, and then automatically start formulating an answer, especially if it's an open-ended question. Not so much an incorrect or correct answer, but think about an open-ended question like this one. And before you look at the options, start to formulate your answer and then look at your option. That's a really good test-taking tip, especially if you sometimes go back and forth between two options. So your first guess intuitively is usually correct, right? This is another reason that you shouldn't change your answers at the end of a test. And so when you read a question, you automatically, without even cognitively knowing this sometimes, you automatically generate the response by reading the lead of the question and then compare what you think about immediately to the responses that you see, the options, and then select an option, right? That's just a little test-taking tip that may be helpful. Okay, let's do this again here. So relaunch. All right, so last few seconds. Okay, great. Let's take a look. Lot of response for B. So what is the primary function of thyroid hormone? And again, this is another really good question to practice that strategy. So when you think about thyroid hormone, what are the first couple of things that come to your mind? Probably words like metabolic, right? Words like energy consumption, words like energy demand, right? Metabolic rate, and so on. And then you can compare those thoughts, those ideas, to what you're seeing here, okay? So B was the correct answer. So regulating the body's metabolic rate is the primary function of thyroid hormone. Decreasing blood calcium level is actually calcitonin. We talked about calcitonin just a little bit. Another hormone secreted from a different part of the thyroid. C, stimulating the hunger sensation. We did not speak about leptin and ghrelin just yet, but those are the hunger hormones. And then D, regulating sodium reabsorption. Again, we did not speak about ADH, which is another hormone we'll talk about later on. So the correct answer here would have been B, metabolic rate. All right, let's look at another. All right, last seconds. Okay. So lots of response for C. Sorry. Okay. Name the hormone secreted by the beta cells in the islets of Langerhans of the pancreas and give its function. So C is correct. This is probably the obvious answer, insulin, and this is going to decrease blood sugar levels or blood glucose levels. So that would be correct. Okay. If this were to say alpha cells, D would be the correct answer. All right. Okay, so the correct answer here, C. All right, let's look at one more. Last 10 seconds. All right, let's take a look here. A lot of response for D, which is correct. So which of the following statements about the post-absorptive state is not correct? And so even if it helps you during the exam or so to write the word fasted here, go ahead and do that, right? So you can think about the big picture of what's happening here. You've gone a long time without a meal. That may help you actually, make sense of the options here. So which of the following statements about the post-absorptive or fasted state is not correct? Another little tip for these types of questions, so these negative questions that ask for not, is to think about this question in the direct. So start out completely ignoring the not. And I say to do that with caution so that you don't forget to think about the not, but just start out not thinking about the not, okay? So think about the question in the direct. So which of the statements are true, right? Go through all the statements, think about which of them are true, and then identify which one is not true. So it is primarily a catabolic state. So the post-absorptive state is the fasted state. It is a catabolic state. So this statement is in fact true, right? Let's think about B. Its primary function is to maintain plasma glucose levels. Is that something that is in accordance, right? Is in coordination with the fasted state? Yes, it is. If I'm in a fasted state, I'm trying to maintain my blood glucose levels until I can have another meal. So this is also a true statement. C, there is cessation of nutrient reabsorption or absorption, also a true statement, right? If you're not in a fed state, nutrient reabsorption kind of subsides, excuse me. So this is also a true statement. And then insulin is actively secreted. Insulin is secreted when we have a large meal, right? Think about a large meal and insulin. And so this would not be secreted in the post-absorptive state. So this is not a true statement. Okay, and so you can identify this as the correct answer. So with this negative question, try to think about the question in the direct first, and then think about applying that not. It may be a little bit harder to think about, is this not a true statement? As opposed to thinking about, is it a true statement in the direct, okay? All right, so the correct answer here was in fact D. So insulin is actively secreted, is not the case.